You're about to hear something all new to the world of aesthetic medicine. Five of the country's most credentialed surgeons, each at the top of their specialty, having the honest conversations that shape exceptional results. This is where surgical expertise meets collaborative excellence. This is Aesthetic Authority.
So we're here today with Dr. Vito Quatela, our visionary and founding partner of the Quatela Center for Plastic Surgery. And, between Dr. Quatela and myself, we have the founding partner and then the newest member of the surgeon staff. And so, a big gap between the two with a lot of time that has passed and the story that I'm thankful to know a lot about. But I think a lot of our viewers want to know about is how we got from the start of the Quatela Center to now. And so thought we would start with that and have Dr. Quatela officially introduce himself and then go into your story about how this all began.
So, my name's Vito Quatela. We started, this started a long time ago. It started with a passion to work with kids, actually. I was going to be a pediatrician and then found myself uh, on a 2-week rotation on otolaryngology and got interested in that. And it's like anything else, mentors really influence your life, and so I had a mentor who happened to be the director of the residency program, who was also a facial plastic surgeon, took me under his wing, and on Saturdays, we went up to his private office, and one thing led to another, and I was doing a fellowship in facial plastics. And so I'm grateful. I'm always grateful to all the mentors that have crossed my paths. The preceptors that I did a fellowship with influenced my life. Partly, the Lindsay House was influenced by one of my mentors who had a sort of an antebellum mansion in Louisiana,
Oh, wow.
and it started with a thought there. And actually, when I was a surgical resident in Vermont, another um, Dr. McSweeney took me under his wing and took me to his office, and it was his dad's old office, and it was an antique internist's office with oak cabinets and all that. So I was influenced from an architectural standpoint there. But uh, Lindsay House, started fundamentally not as my original idea. When I came to Rochester, I was at the University of Rochester. I was very much interested in resident education and wanted to be in an academic setting, and then realized very quickly into the process that I was an entrepreneur trapped in an academic body. But it took me 15 years to sort of say, okay, I need to do something else. And it was a combination of things. One of my unique abilities is 3D problem solving. So
Mhm.
if you put me in an OR with a patient and a hole in their face, I'm turned on, about how to solve it,
Definitely.
or changing someone's nose. But if you put me in a room with an architect and blueprints, I'm equally enthralled, and I can sort of picture bathrooms on 3 floors and all that sort of thing. So that is like, it's a parallel passion, if you would. So when I was at the university, they gave me the leeway in my last 5 years as a full-time attending to pursue the Lindsay House. And so basically, they changed my office from being at the university, even though I was full-time faculty, to being here. And so I had the liberty to change this place the way I wanted to and make it work the way I wanted to. And it was very gratifying on all levels because I actually enjoyed every minute of the planning and the execution, and it sort of fulfilled, like, a lot of thoughts about how I wanted to see a practice run.
hmm And so it seemed like you had some models to work from then. So
Mhm.
this wasn't a truly de novo idea that something that you've experienced throughout even your training.
Right.
But clearly there is nothing that existed here in Rochester that was quite like this. So what did you see in Rochester that said, yes, this is 100% why I want to do it here and where I'm going to do it?
So, you know, uh, I think we're both in the Northeast
Yeah,
because of family,
yeah,
and
exactly.
family is everything. And so, um my wife came back here kicking and screaming because she wanted to be in a big city, and I took her from Chicago, and she wanted to be in Baltimore, New York, Boston, and but brought her to Rochester, and it was very good to our family, good to her. She had an amazing career here with Kodak and
Mhm.
Bausch and Lomb and all that. But I saw beyond just the family, and I saw an opportunity here. What I had envisioned was I always do this. I take a good idea and then I remodel it and I mediate it. I'm a mediator. And so, all my mentors, even the one in New Orleans, he did a facial plastics practice, one person. He had a little office OR.
Mhm.
But I envisioned what I have here now was a one-stop shop where you came and in this place, we took hair off your body and we put it on your body. We do everything from a minor peel to a very deep laser.
Mhm.
Um, no breasts, with breasts, it's just and so I had this concept of under one roof, you'd have anything you wanted aesthetic, whether it's from something very minor to something very complex, and so when I envisioned it, I said it had to have its own surgery center. It had to have, a place for patients to recover. It had to have an after treatment area, a medical spa.
Right.
And we were the second medical spa in Rochester to be developed, but I developed it really for aftercare for patients, and it's continued to serve in that manner.
Okay. And so even from the beginning, you were thinking this is head to toe plastic surgery. It's not just facial plastic surgery. Is that right?
That's correct.
Okay. All right. But that's not how it started for the first several years.
That's correct. It was, see, it was about 8 years, I think,
Mhm.
before I brought on a plastic surgeon, but,
Mm.
I had to get my feet wet. I built an OR and I thought, "Oh, this is great," but you can't sustain an OR with one surgeon,
Yeah.
so I had to, find surgeons to fill the OR, and it wasn't gonna happen right from within our practice, so there were a lot of steps in the process. I also had to extricate myself from the university,
Right.
which took a couple years, and so, um, you know, getting to where we are now is kinda where I wanted to be all along, but it was a process.
For sure. When you made the decision
Mhm.
that it was now the time to bring on your first partner, what was that like?
So, I was I had by then, I had built a reasonable reputation in town, but I felt that if I was gonna fulfill this dream of a one-stop shop, I really needed to have a plastic surgeon. And so I went through the interview process and, um, looked at the journals and, posted, everywhere I could. It was different back then. And I was just worried. The whole brand that we have here is excellence. And I was, so I never forget, I went down to visit Dr. Koenig, in Sayre, Pennsylvania, and I watched him do surgery for a day.
Uh-huh.
And actually that's been our modus operandi. I know that he went and watched Ashley and whatnot, but and I remember that the person there was suspicious. He was a cardiothoracic surgeon who was the head of surgery down there, and he was asking me, and it turns out that both Bill and I went to Northwestern, to medical school
Uh,
at different times, but
uh-huh.
but so that was the bond. You said, "Oh, we were both Northwestern,"
Uh-huh.
but, he didn't know that I was really there to hire him away, and,
Uh-huh.
he was an outstanding person, an outstanding surgeon. I was so blessed to have him as a partner for so many years,
Mm.
and I think that, that outcome and that relationship is, what said, "We can grow this, why let him retire and not make this bigger than we."
And that was very early 2000s. He started in 2002, 2003.
Uh, you know what? I think it was more like 2006.
'Cause he was here for about 20 years. Okay.
6,
So
yeah,
just shy of 20
yeah.
years. Okay. Um, and then talk a little bit about then the sort of pipeline that now you have, at least for facial plastic surgery, and that's more or less through your fellowship. So when did that start and how did that start?
So, I started at the U of R primarily because I liked education, and I actually, early on thought, "Oh, you know what? I could be a chairman," that was sort of in the cards. But then the more I realized, like, what a chairman of a department actually did, and the more I realized, like, what my passion was, I sort of stuck to teaching, and so I think it was 6 or 7 years into practicing at the university that I got my first fellow. It was 1995,
Okay.
and, so I had a fellow for the last 5 years that I was at the university. And the fellow was great because, the residents are great, but they come and go, and
Definitely.
you'll have one day, one another.
Mhm.
But when you have somebody one-on-one, they basically they suck everything out of your brain,
Yeah.
and you have no, you can't do anything, without being questioned why you're doing this, why you're doing that. So it was kind of like, I don't know, I just enjoyed it. I enjoyed to introduce innovation with the fellows and to just kinda watch their journey, and, when I look at all the things that I've done, building, ambulatory surgery centers, being president of the academy, all different things, the thing that has given me the most pleasure and the most reward has been the fellowship program. I'm on my 31st fellow, and they're like my children. If I go visit, like I was just in LA for the annual meeting, and 15 of them showed up just to have a drink and to
Right.
gather and talk.
Right.
And so, and now I have grand fellows. I have fellows who have had their own fellowship, and now they have their fellows,
Yeah.
and they're just as important.
That's a true full circle.
Yeah.
Yeah. And it's what I hear is like, and what I've noticed even within practice so far is having someone that's there to learn from you pushes you to then continue to one, learn and even potentially innovate. They're always asking the questions. And it might be something that you has say, I've had plenty of mentors that say, well, that's how I've always done it. And I never liked that answer.
Yeah.
And so and it has made me say, well, why do I do this? And having all those answers. And I think that pushes us to one, have those answers, and two, then critically think about what we're doing
Yeah,
and should we change things?
you're so right, Peter. I didn't have all the answers for my first fellow.
Yeah.
I would say, "This is how I was taught," or,
Right. Right.
but then you developed a reason, and a really good reason, and sometimes your fellows changed how you thought about it. And I gotta say that the teacher becomes the pupil, and I've learned so much from my fellows, during fellowship and even after. And we had a gathering, 21 of us gathered in Idaho for a fly fishing weekend, and we gave lectures to each other, and the theme was everything I do now that I didn't learn in fellowship, and I was fascinated. I was
Yeah.
taking notes like a madman, you
Yeah.
know? So the fellowship's just been, an amazing thing, and, something I'll continue for a while. I'm hoping that Dr. Montague and Dr. Lee,
Uh-huh.
pick up the fellowship as well,
Uh,
because I think that, Dr. Lee says, "Oh, I don't have a lot to teach," and it's so wrong. We have so much to
right.
teach. You have a ton to teach, and, I think that over time, you'll wanna do something like that
Simpler.
too.
Yeah. I mean, I could see that, throughout practice and, you're in practice hopefully for a long time. There's different things that can potentially fill that bucket for you. And I think teaching is one of those things,
Yeah.
certainly. And I, that's something that I sought out. And for example, knowing that there is that element of teaching that happens here, teaching the next generation of plastic surgeons and facial plastic surgeons, I think is something that is very fulfilling on
Yeah.
top of everything else that we get to do as surgeons. So I think that is a nice added benefit to a place that's so established as this is. And it sort of gave us Dr. Heather Lee and Dr. Alex Montague as your prior fellow. So
Right.
talk about what that process was like. First with Dr. Lee as one of your next hire, but one of your prior fellows.
Yeah, so, it's probably easier to assimilate a prior fellow
Uh huh.
than it would be someone, that you completely didn't know. So both Dr. Montague and Dr. Lee have been like, bringing back one of my children to the practice, so it was like I knew everything about him. There were no surprises, and it's just wonderful to see him grow. So now I peek in the operating room and I see she's doing something a little bit different. She went to a meeting and came back, and it just warms my heart. And when I see that about a third of my patient log is really in her patient schedule now, that warms my heart too, because it tells me that it isn't just about me. It's about the quality of and the excellence of the work that's exemplified in all the surgeons here. And I think that's great. And I want to you mentioned something earlier about how the fellows drive you to innovate, and I think innovation's so important. And a fundamental thing to innovation is that you have to be active. You have to go to meetings. You have to read papers. You have to have a willingness to learn forever. No, it's not all done when you finish your training. And I always say that the day that I stop innovating is the day that I stop practicing. And sometimes I'll change things that I do because I get bored. And so I'll do a technique that maybe I did 15 years ago, but with a different twist. The thing that was missing in it, that made it better. And so I just encourage everybody that I train and everybody that we work with to go to meetings, look at new things. I mean, here I am. I'm going to a preservation rhinoplasty meeting next month. I want to know I want to know what's involved there.
Yeah.
And I think that that's the way it should be.
Yeah. Do you find that the sort of setup that you've created here helps with that? For example, the fact that you have yourself and two other facial plastic surgeons, that we have two uh, body and breast specialists here. The fact that you can bounce ideas off each other and you say, oh, you heard about that. That's a neat thing. I've never tried that. Then you go ahead and try that. I think that the internal sounding board versus the solo practitioner who has done something the same way has to go to a meeting and then they say, well, I don't have anyone to bounce that idea off of. I find that this setup is probably primed to continue to innovate.
Yeah. I think that's so true. I didn't have a forum, like you have an idea or a thought,
Yeah.
or you have a situation that may not have gone exactly the way you wanted. And it's so nice to have someone to sort of bounce an idea or a thought. And you know what? We've all gone through medical school. We're all smart people and we all have, different ways to approach things. And so even though I trained, Dr. Montague and Dr. Lee, they look at things differently and they also have read things that I haven't read. And it's amazing when we have a difficult case and we exchange ideas that can happen under one roof,
Right.
without picking up the phone and calling a colleague. And
Right.
so I think there's tremendous value to that.
Yeah. And that vertical mentorship continues. And it's, again, like I said, a two-way street because you pick up things that they're seeing and that they're trying, and it goes both ways. And I think that level of collaboration is, I think, one of the most special things about a place like the Quatela Center. And when I, for example, was looking for places to start my practice, I knew, there's always the nice thing about plastic surgery is there is always the option that you go and try to just hang your own shingle and start on your own. Um, but there's a lot that you lack if you do that. And I think that is one of those things. And what I found in many of for example, the surgeons that I would work with that are solo practitioners is they can get into that same rut as I get good results when I do things this way. So why would I ever change those things? And, there's obviously the truth to wanting to get good, consistent results. I think that's a given when you're a plastic surgeon, right? Everyone wants that. Um, but things change, trends change, ideals change. And how do you pick up with that, And I'm sure in the time that you've been in practice, you've seen a lot of those shifts. Do you find that is an additional thing that drives innovation for you, or is it more so I need to do what's the next best thing.
No, I think, I think we don't all come up with original ideas, but there's so many great people out there who come up with original ideas, and you have to be an open mind, and that's why I think exposure to meetings and exposure to other surgeons, you bring home all sorts of things. Yeah.
Mhm.
In the mission work that we do with the Hugs Foundation, I'm exposed to, people from Stanford, Harvard,
Right.
and every once in a while, I'll see something, go, wow, that's a much better way to do that,
Yeah.
and it's
Yeah.
great. It's just, and you come back and you're energized and enthused. And anytime you innovate, I think it rejuvenates the whole, experience that we do.
Yeah. I agree with that. And so now with the full practice with
Mhm.
3 facial plastic surgeons, 2 breast and body specialized plastic surgeons, with a med spa on the 3rd floor with our surgery center, everything under one roof. How has that collaborative approach that you always saw and sought out, how does that work in daily practice?
Well, I think the collaboration is great because there's an interaction of not only, body plastics, facial plastics, but on all levels. And so when I look at the degree of focus and specialization at every level, it exists. For example, in the medical spa, we have Jen, who's done IPL and BBL and done pigment sort of resurfacing
Mhm.
for like 23 years. She's used every machine that's come down the pike.
Yeah.
And her focus in that arena is so specific. Um, our hair transplant technicians, that can do FU, can do so many parts of these procedures. That's a highly focused group. It's not like you can pull them out to do something else.
Right.
And the same is true of the surgeons, we're very focused on what we do, and we're not generalists per se, and I think that that has value in terms of outcomes, and it could even get more specialized. We may end up with a facial plastic guy that just does noses,
Right.
and
Yeah.
that's okay, and the person that goes to him for their nose probably is gonna, get the latest and the greatest. And
Right.
so I just believe that at every step of the way, the more focused, and we do that, with spa staff, where certain spa staff do more of one thing than another, or they use one machine more than another, or use certain, fillers more than others. And so I think it's important because the more that you focus on your craft,
Mhm.
the better you're going to get at it. And the
Right.
more focused your focus is, the better you're going to get at it,
Right.
you know?
Yeah, and I think there's plenty of data on that in
Right,
different systems that you focus on. Even the people that focus on
right,
one surgery
right.
get the best outcomes in
Oh
those
yeah.
surgeries.
We saw that with microtia for years with Dr. Brent. All he did was microtia on ears, and that was it. But who was the best in the country at it? It was him,
Right. Right.
So
And the collaboration and the one-stop shop approach, I think, even in the time that I've been here, I've had multiple patients that either saw yourself or Dr. Lee, Dr. Montague, and there's variations in our average patient's age and what they're looking for, but there's certainly a patient population that comes in for something specifically that you're seeing them for, and then they ask about something else,
right,
and you don't necessarily do that. Everywhere else, you'll have to say either you do the full spectrum of plastic surgery and you're not truly focused, and maybe the outcomes aren't quite there to support a high level of care that we're aiming for. But here, you could say, I have a person for you. They're right upstairs or they're right downstairs.
right,
And the amount of times I've done that and referred a patient to one of your clinics for blepharoplasty, for the full facelift, someone that I've been seeing for injectables, and I say, this is a patch and I have people that can do something that's a little bit more permanent. Are you interested in hearing about that? And some people are, some people aren't. But having a place that say you don't have to go anywhere else. You don't have to go meet a new front desk staff. We could set you up before you leave today with an appointment with somebody,
right,
and having all that be able to happen in the same place is helps the patients, right? The
right,
the patients are looking for familiarity. They're looking for a continuity there, and
Absolutely.
they see the same people every time they come. And I can't I bet you have the same number, if not vastly more, but the number of patients who just like coming here
Yeah, yeah,
because they're so familiar with it,
yeah,
and sending them somewhere else just would be brushing them off.
yeah. When they ask a patient that's out of my area,
Mm,
when they ask for a recommendation and I say, "Oh, we have somebody great here," you can just see the sigh of relief, because they have confidence in the place,
right,
and now they don't have to look any further. I mean, it's that easy.
right, yeah, and building it's more than just a brand. I mean, this the whole center is beyond that, because it is that sigh of relief that you get from a
Yeah.
patient. It's that uh, comfort that they have with knowing that this is what they're signing up for, right? It's a stamp of excellence across the board, that they're both expecting and that they can expect to get,
Mhm.
as if they know that they're being taken care of with someone under the umbrella. And so casting that wide umbrella, I think, has just benefited the patients.
Yeah. I think there's, just looking at this from my business eyes, there's the value to the collaborative effort in building the practices. I think you build uh, each other's practices at a more rapid rate when there's this cross referral rate
Definitely,
within the same
definitely,
practice. I
yeah,
think the consistency of the care we give, the aftercare, is all done kind of on the same level.
right,
I think that, the cross referrals just come much easier,
right, yeah,
and just coming in the building and knowing that we do from A to Z, just the patients knowing that is huge in terms of referral. I mean, somebody who might go to the spa for, M-Sculpt then shows up to you for liposuction
right,
because,
yeah,
that's not really the treatment for them,
right,
but we send them down to you. And so there's this funnel that exists that
mhm.
that wouldn't exist if you're a solo practitioner.
Right, right, and then having those multiple touch points with the
Mhm.
patient too, and having, there are patients that we have that probably know more about every level of this business because they are downstairs in the facial plastics clinic. They come and see me in the body clinic, and then they're up in the med spa.
Right.
And so they have those touch points almost more so than we have that work here on a day-to-day basis.
Right.
And I think that, that level, and it's collaboration, not just amongst the surgeons, but
Yeah.
amongst everything. I went up and I spoke with our staff members at the spa, and we talked about the things like, what can M sculpt and cool sculpting actually accomplish? When is liposuction the better
Yeah.
option? What are you seeing in those patients that maybe that's a referral downstairs for more of a liposuction or tummy tuck consult? And being able to have that discussion, and in the same sense, what am I seeing in my clinic that I say, that's a great patient to go up to the spa.
What you're touching on now is something that we haven't talked about, but it's a very important point. And that is that when you take your average med spa that doesn't even have a physician present on site or anything like that,
Mhm.
and you look at the amount of education that we as physicians give the med spa, it's a whole different thing. For med spa to know what are the limits
Right,
of M-Sculpt or Cool Sculpt or whatever, that's so valuable, and to have a surgeon take them through that and
right,
show them at what limit you go to lipo,
right,
that makes that spa staff so much more valuable,
correct, yeah,
in their recommendations, and
correct, and not having that, then leads to, potentially poor outcomes for the patients. And so having all that in one place, and that just the education piece, the education throughout, I think is very, very beneficial. So with the growth of the practice and, with your original partner, Dr. Koenig's retirement, that was when I was coming on. And so, uh, clearly that was a big space to fill in the group and in the
Mhm.
practice. What were you looking for, and what do you think you found, hopefully in myself, in that replacement for Dr. Koenig and for the growth of the practice for the future?
So, we went through the usual machinations of
Uh,
looking at your letters of
right,
recommendation and where you trained and the the experience you had and your case numbers and all that, and you met the grade like in every which way. We interviewed you, personality-wise, you're amazing, but the proof's in the pudding, right? And
Yeah.
unfortunately, you don't really know till you know.
Yeah.
And so when we had the ability to have you work alongside with Dr. Koenig and, obviously do your own cases as well, um, uh, he, has been one of my hardest critics my whole life,
Yeah.
and he would just tell it like it is always.
Yeah.
And I think you were only here for a month, and he came up to me and he said, "This is the absolute right guy." And for him to say that, uh, was amazing, and I think I then started sleeping better because you just don't know until it all and,
Yeah.
we've had some ups and downs in the past, and
Right.
so you kinda know, but, like, you know, you're serious about your work, you're kind, you reflect all the core values that we have, at the Lindsay House. You have a can-do attitude, you treat people like people, everything. You have a passion about your work, I can tell. You're a great surgeon. I mean, like, what else could I want?
Right. Well, I appreciate all that. I remember after working with him one day, and you were working alongside in the second OR, and after he left the case, he came back to the room and said, "I just told Vito that I think you're going to do great." And I'm like, "Oh, well, that's
Yeah.
nice." He never told
Yeah.
me that either, but
Yeah,
I think,
it's true.
yeah,
It's absolutely true,
yeah,
and so, yeah. So, yeah, we're glad to have you.
yeah,
It's like, yeah, it's a blessing. Everybody we have here, I really feel that if I'm not here, the brand, the quality will go on, and that's all I can hope for. I just can hope for, like, 20 years from now, they say, "Oh, yeah, that place is great."
yeah,
And, if you go there, you can no matter what you do there, it's gonna be great. And I think that, we built the groundwork for that, and I think if you guys are as careful as we were picking you and picking Heather,
yeah.
you'll continue to add people to the practice, and it'll grow, and yeah.
And in that sense, looking forward the
Mhm.
next 10, 15, 20 years, we have, the establishment of like a center of excellence.
Mhm.
Where do we expand from there? What are our next steps?
Yeah. So I've thought about the future. The one thing AI can't do still today, AI will have its biggest expression in robots, and we'll have lots of robots floating around. Might have robots at the front desk, but robots today, and I don't see it coming in the near future, don't have dexterity. If you watch them folding a towel, it's a project,
Yeah.
and I don't think that they'll ever do what we do. And, they have robots doing some abdominal procedures, but some of the delicate things that we do,
Mm. That's still
suturing,
human power.
it's very complicated. I mean, and so I don't I don't see that, being an issue. And so I see the specialty continuing to grow and expand even through the age of AI. But uh, I there'll be innovations in technology. We see it all the time,
Mhm.
just recently read about narrowing ribs using a piezoelectric needle,
Mhm.
so that using a piezoelectric needle so you don't even have to make an incision and you don't have to functionally break a rib. And I just think, there's so many more things like that coming down the pike. And the interest, I don't see the interest, declining.
Right.
I think that, um there's a ton of interest in this country, but there's more interest in Korea and
Right.
in Turkey, and
Right.
there's, so I just see that the growth potential is good. Despite minor recessions and all those things that we encounter, what I've learned is that people value what we do. They may not do as much of it if we're in a downturn economy, but they'll still do something. And I remember, when we've gone through in my work, in my career, at least 4 downturn economies, and our fillers injections went up, and people would do their eyes and do their forehead the next year, but they would do something. And our in a downturn economy, we've never had a downturn year.
Yeah.
And it's just, I hate to say this, but like in New Orleans, people would rather be a member of a crew and be part of Mardi Gras than put food on the table. And I think the same is a little bit true about cosmetic surgery and about how people feel about their appearance. They'll forego some other things in their life and put this ahead of it, which is kind of an interesting phenomenon.
Yeah. And the value, even with any downturns, the value that this provides patients isn't changing, and so it's just the calculus then for that individual patient. And I think that's one thing about the comprehensive approach I think that we take, both from a facial plastic surgery and a breast and body plastic surgery standpoint, is it's not just, this is the one thing that will help. There are a number of procedures, a number of interventions along the way that, each is incremental step potentially,
Right.
but you can break these things down.
Right.
And sometimes it's better to not do it all at once. Sometimes it's ideal to do it all at once, but a lot of times breaking it apart is both necessary or beneficial to the patient.
Surgery is not for everybody.
Yeah.
And the point is that we have something here to offer them wherever their mindset's at. If surgery is totally out of the question, either because they don't want it or for health reasons, there's something else that we could offer them.
Right.
And I think that's an important.
Right. Yeah. And in that sense, the continued focus is on the quality, the safety, and just the overall experience. And I think, one thing that struck me the second that I started here, but even before when I was just interviewing, is the overall, not just quality, but the experience. It truly is the Quatela experience, and, our motto, creating uplifting experiences. That is what this place does. And it's from walking in the door, or it's to, not having to go to the hospital to have your surgery. Like these little things
So
that are, are a daily thing, but it's huge for patients.
yeah, I've always been asked, what what was one of the turning points, where that you thought you could accomplish what you had envisioned. And it's interesting that you bring up the hospital
Huh.
because I needed to control the touch points. And I built the surgery center in 1995, and I built it to hospital code, but I didn't have licensure because it wasn't available till 2000. So in the Rochester community, 500,000 people, one ASC. And we were only 200,000. So I thought there's never going to be more than one ASC. And then they changed the law.
Yeah.
I applied, and we were the second ASC in Rochester. And, the reality was that was the turning point, because now I controlled all the touch points,
Right.
preoperative,
Huh.
the actual surgery, and postoperative. I'll never forget, I did the wife of a CEO in town at Strong, and she was a facelift, and they put her next to her best friend in Prian, who was having neurosurgery for a brain tumor. And that woman, after surgery, went into a depression about how self-conscious she was about having cosmetic surgery while her best. And did I have any control that they were going to end up side by side, And so when I got the approval for the surgery center and knew that I had full game, that I did have a one-stop shop under one roof, I said, okay, we can control every touch point for this patient.
Yeah. And that's, pieces all coming together. And everything else is, from a patient perspective, every other thing is icing on the cake. The close follow up that they get, and seeing the same providers over and over again. And yes, we have ancillary staff, but they know that we're there. I think every step of the way that experience is consistent, and I think that is one of the, especially for the Rochester community, for Western New York community, that is the biggest thing that separates the Quatela Center from everywhere else out there. Is you have an experience that that you're going to get when you come here, and maybe you don't know that to start out with, but you experience it and then you do. And so I think that is truly the full extent of what you've built, that has grown tremendously to now having 5 full-time surgeons on staff, a full 2 locations of a medical spa, the full surgery center, and truly an impressive build, and something that I saw immediately when I was hoping to join on, and I think everyone that comes here is something that they experience, and so I think that's truly sort of the full spectrum of where you began and where we are now. And I think a little bit into where we're going in the future, and with, I'm sure, some surprises along the way. But I think that gives a good sense of this, at least the beginning of the story.
Future growth
Hmm.
is what we're seeing now is headed in a direction that we're already part of. We talk about becoming, an international destination, but if you fall short of that and you're nationally recognized, I mean, then the future growth is outside this catchment area. And
Right.
I mean, now anytime I walk in the operating room and I say, "Where's this patient from?" This week, Tuesday's facelift was from Wyoming. Wednesday's facelift was from Connecticut. Yesterday's was from Fairport, but
Mm.
but but it's like that's our future.
Right.
You're gonna have the same experience because that lady from Wyoming, if she had a great experience, she's coming here
Yeah.
for even I have patients who travel from Florida just for Botox. It's
Yep.
it's crazy, but that the power of the draw, knowing that it's safe, all the
Right.
things you said, that you have excellent care.
Mm.
Uh, that's where the growth is,
Right.
and it's gonna be outside this catchment area.
Right. The continued growth of our practice and, growth of my practice, and filling out all of our schedules, which is happening rapidly, is to a certain extent based on not just Rochester, not just Western New York, but, even in my time here, I've had patients come for surgery from Connecticut. I've had plenty of patients from Pennsylvania. I think there's a need in this wider, even regional area, much less nationally, and people will travel
Mhm.
for value. And I think seeing the value in the place, the Lindsay House, and the practice and the people that all work here, I think that is probably the value that will continue to draw people, will continue to allow us to grow, and allow the center and the brand to continue to thrive. So I think that growth that you just mentioned is very important. I'd like to thank you for your time. Thank
Thank
you
you.
for sharing both the journey and the experience that you've had. We'll continue to be able to get into your memory of the time here and the practice, but also the expertise in more surgical things as time goes on. But I think this is a very nice starting point to let everyone know how the Quatela Center came to be and where we're going.
Thank you.